Okay, ma'am.
Okay, so if you've read and understood, considering it critical care scenario, please tell me how would you manage this patient?
I'll manage the patient according to the critical care inpatient management protocol and give the patient in oxygen, high flow oxygen, secure the IV channel and give the IV fluid and the IV antibiotic according to the local task policy. I also take the blood for uh, count that complete blood count, blood culture, liver function test, and electrolytes, and also give the urinary catheter to monitor the urine output.
Okay. Why would you think patients' labs show that there is no urobilinogen detected in urine? What
Yes,
provisional diagnosis would you make out of that?
yes, this patient may suffering from the obstructive jaundice.
Okay.
And the urobilinogen is not found because due to the obstruction, the bile flow of the bile, the bilirubin cannot reach the intestine, so urobilinogen is not produced here.
Okay. You said, all right, what are the different types of jaundice that you are aware of?
Yes, it may be the prehepatic, hepatic, and post-hepatic jaundice.
What type of jaundice would you determine or would you say this patient might be suffering from?
Yes, it's a post-hepatic jaundice, that is obstructive jaundice.
Okay. Obstructed. Okay. What is the normal level of bilirubin?
It's a 3 to 30 micromole per liter, and when it's more than 35, I'll detect the jaundice of the patient.
All right. What are the different types of bilirubin that you can tell me?
It may be the unconjugated and the conjugated bilirubin.
Okay. What is the normal value of conjugated bilirubin or direct bilirubin?
Yes, ma'am. It's from 0 to 0.3 milligram per DL.
All
And
right.
directly it's 0.3 to 1.9 milligram
Which
per DL.
form of bilirubin is formed in the blood?
Yes, it's a free bilirubin as well as the conjugated bilirubin.
Considering the fact that patient is suffering from obstructive jaundice, what other condition can occur? Especially
Patient may,
when patient has presented with vomiting and episodes of diarrhea.
yes,
And now,
patient may suffering
yes,
from the
yes.
cholangitis, fat malabsorption,
Okay, patient
and the
is,
coagulopathy.
yes, that I wanted you to tell me because severe epigastric pain may lead to, if there is a deranged clotting factors, so
Cholangitis.
this can lead to, okay, which clotting factors can get affected because of obstructive
Yes, ma'am.
jaundice?
Due to the obstructive jaundice, there is there will be the decreased absorption of the vitamin K. So the vitamin K dependent clotting factor like 2, 7, 9, and 10 will be impaired. So it's
Okay.
difficult in the coagulation of the patient.
All right, so there'll be decreased vitamin K. This will lead to increased production of what?
Prothrombin time or iron.
All right, okay. Please tell me, out of all these labs that you have done, which one is important and signifies liver pathology?
Yes, ma'am. Gamma glutamyl transferase,
Okay,
GGT.
DGT. Right, please explain the metabolism of bilirubin.
Yes, ma'am. The conjugated bilirubin goes to the bile and then goes to the intestine, and the reabsorption of the bile salt in the terminal ileum and enters the enterohepatic circulation. And the conjugated bilirubin that does not absorb, that goes to the colon, and in the colon, with the help of the colonic bacteria, and the conjugated bilirubin become deconjugated and metabolized to form the urobilinogen. The urobilinogen, 50% of the urobilinogen re-enters the enterohepatic circulation, then excreted into bile. And the part of the urobilinogen passes to the kidney and passes to the urine, and the other remaining part of the urobilinogen oxidized to form the colorless stercobilinogen that gives the color of the yellow color of the stone.
Basically, it gives the brown color to the stool.
Yes, brown.
Okay,
Yes,
please tell me what is enterohepatic circulation?
yes, ma'am. 95% of the bile salts reabsorbs in the terminal ileum and they return them back to the liver.
What are bile salts?
Yes, bile salts are the conjugated when the bile acid conjugated with the glycine in the liver and the sodium and potassium salts of the conjugated bile acids are called the bile salt.
Okay, please tell me which investigations would you carry out in order to help this patient?
Yes, I have already done the liver function test here and I also do some other investigation like serum bilirubin, serum alkaline phosphatase.
And
Yes, it has done and the ultrasonogram of the whole abdomen, special attention to the hepatobiliary system to
and
see any inter and extrahepatic dilatation or any stone in the common bile duct. If there is any stone, then I will consider the ERCP of the patient.
yes, okay. Why would you go for ERCP?
Yes, ma'am,
And
ERCP is the
what is
diagnosis.
ERCP? What is ERCP? Can you explain? It stands for?
Led to
Okay, we can
get
come.
cholangiopancreatography.
Okay. And why are you doing this? Why are you
Yes,
going for
it's
ERCP?
the therapeutic as well as the diagnostic as well as the therapeutic.
Yes. If I ask you to explain how is it therapeutic, would you be able to explain which
Yes, ma'am.
procedure you can? Yes. Go ahead and do it with this.
If there is any stone in the common bile duct, and I will extract the stone by papillotomy and extraction of the stone with the help of the Dormia basket.
All right, good. Right. What are the okay. All right, okay. And at the same time, if patient needs, what more you can do?
I also give the stent here also.
If needed, yes,
If
to
needed.
relieve obstruction.
Yes.
Okay.
Yes.
What about after an ERCP? What advice would you give to the patient? And also at the same time, if patient has fever, you will give the antibiotic.
Antibiotic.
And
Yes,
post ERCP advice, patient has
I'll
to
advise
come
the
back
patient
after, yes, after 6 weeks.
6 weeks. If there is the gallstone, I'll do the cholecystectomy.
Yes, all right, okay. What more you can tell me? Right. How would you correct clotting abnormality?
Yes, ma'am. I'll consult with the hematologist and I'll give the injection vitamin K.
Okay.
Also consider the fresh frozen plasma and prothrombin complex concentrate.
Okay, please tell me what is prothrombin complex concentrates? Okay, this is
Sorry,
your
ma'am.
homework for
Okay,
next time. Yes.
okay.